Welcome to the Optimized podcast from Prescribe Fit, where we explore the intersection of orthopedics, lifestyle health, and virtual care strategies to optimize patient outcomes and private practice success. Join us to hear from industry experts as we dive into the tools, technologies, and approaches shaping the future of orthopedic care.
Hi, listeners. Welcome to the Optimized podcast. I'm your host, Brock Leonti. This podcast is for clinicians, physicians, industry, and orthopedic and healthcare professionals. I'm joined today by Thomas Cunningham, a seasoned expert in private equity, healthcare merger and acquisition, and physician practice management. Thomas and I will dive into key insights on financial strategies for independent orthopedic practices, the evolving role of ancillary revenue, and how telehealth and remote patient monitoring are shaping the future of musculoskeletal care. We explore the biggest trends in orthopedic private practice consolidation, common mistakes made when implementing ancillary services, and what business strategies will be most critical for private orthopedic groups to thrive in the next decade. Thomas, welcome. Would you mind giving us some background on yourself for the listeners?
Yeah, good morning. Thanks, Brock. Appreciate you having me here. Excited to be here. Yeah, Tom Cunningham. I am based in Chicago, the Windy City. I lead business development for Physician Growth Partners. PGP is a boutique healthcare investment banking firm that helps advise physicians as they explore strategic transactions. Hot topic these days, right? A lot of merger and acquisition in specialty medicine, and we're happy to be a part of that. We're the leading advisor in this space. We've advised over 70 physician groups over the last 7 years, a good number of those being in orthopedics. And prior to PGP, my background, I led business development for a research firm that led me to Michael Croyne, the CEO of PGP. And then prior to that, which ultimately is going to tie into orthopedics here during this conversation, is I was in the medical device space for over 10 years as a rep, as a distributor and a consultant, bringing both med tech and health tech technologies to market and working with surgeons side by side in and out of the operating room, good, bad, or indifferent, right? Dealing with value analysis committees and all the fun stuff of trying to commercialize products, right? So, but had a lot of fun doing that. And yeah, excited to be here and excited to talk fitness, orthopedics, and where things are headed.
Yeah, from the vendor side, being the red tape of the healthcare industry, right? So for that, so that's great. What an impressive background. So your background in private equity, investment banking, healthcare M&A, what drew you to the world of physician practice management, healthcare, and specifically orthopedics?
Well, I'll tell you, the initial draw to orthopedics was prior to med tech and med device. I was in the health and fitness business for about 6 years, managing a bunch of health clubs. And actually, a lot of my trainers were training orthopedic patients, hip and knee replacement patients, right? And got to know them, got to see their recovery post-operatively. And along the way, I started researching devices, researching the space, got connected to some friends, some folks in the space. And ultimately, that's what led to me being in starting my career in 2011 in medical device sales. Just being interested in recovery and just maximizing the hip and knee patient, if you will. Fast forward, right? 6 years in the OR as a rep, 6 years as a consultant distributor, commercializing products, working with surgeons, contributed to a couple exits there in terms of scale, one to Stryker and one to private equity. And so along that process was sort of naturally motivated to be in the M&A space, right? Helping not surgeons just with products, right? From a product and kind of technical perspective, but being the strategic lens and an actual strategic partner, which all reps, all distributors, all consultants in spine, ortho, joints, we're all consultants and partners. But my motivation along the way was, how can I help these surgeons continue to compete and scale? And so that ultimately led me to be in the world I'm in now.
There's a drive, I think, in orthopedics to be independent. They don't want to be a part of a health system employed, but they do need help with resources and making sure that things are in line so that we can operate the business and the business doesn't operate them and they're not weighed down by that. So that's great. At PGP, you work closely with independent practices, maximize their value, looking for long-term sustainability. What do you think are the biggest challenges private practices face today maintaining financial viability?
Oh, gosh. That's a super loaded question, Brock, right? There's a lot of chatter, whether it's LinkedIn or otherwise. Like the two biggest things is a dichotomy of the independent orthopedic group or surgeon treating the same patient today versus 5, 10, 15 years ago, continuing to get paid less. And while their costs continue to go up. So naturally, that's the number one driver to say, like, what's going on here, and how can I continue to compete and maintain our level of autonomy and independence, to your point of what we've been used to.
2.8% reduction in Medicare this year, 2025 alone.
And they play around with the headline, so it doesn't seem so bad. But ultimately, the last 20 years, if you look at the chart, it's pretty demoralizing.
Absolutely. So given your experience in the M&A space, what are the biggest trends that you see in orthopedic practice consolidation? What's that look like?
I think we're seeing three trends right now. One is the obvious one, as we discussed in our kind of preliminary discussion of there's the platforms out there, the private equity-backed platforms who are acquiring practices and it's a vehicle, right? It's an investment vehicle for independent groups to explore and understand. And is it for us? Is it not? So one is private equity. Two is more and more independent physicians, entrepreneurial, young, or mid-career and tired of where they're at, are starting their own practices. So we're actually seeing, call it an anecdotal uptick in starting of practices, which we think is exciting, even though we advise physicians on partnerships. Like ultimately, the early part of any practice, any client of ours, ultimately started with a strategy, started with scale, recruited good doctors and partners, right? And then want to explore. So I think two is the starting of new practices, which is healthy, and that's great, hopefully for the future of medicine and specifically orthopedics. And then number three, we're seeing groups sell out to health systems and hospitals. And those are sort of the macro strategic trends. And I think if you look at it from a product perspective, the other trends in this exploration of three things: value-based care, remote patient monitoring, and kind of what I would call wellness, right? And like, how can that fit in, and how can we optimize a patient in the whole experience of MSK care, which ultimately, what does that mean? And orthopedic surgeons in 1995 didn't have to worry about that, frankly. They had so much work to do and go into the operating room and helping somebody with a new hip or knee. Whereas today, that's still what they're doing, and they're proficient, and we love working with them. And it's amazing to see the recovery and these patients restore their quality of life, yet it's getting more expensive to do that. So finding other ways to be the ultimate health advocate, and not just an orthopedic surgeon, I think is a trend on that side.
Absolutely. Yeah. And it's funny that you picked the year 1995, because there's a stat out there that's true. So the CDC considers an epidemic when an area that they're studying is over 20% of the way that in adverse way. So in 1995, no state had an obesity rate over 20%. And in 2010, every state was over 20%. So when we're talking about optimizing patient outcomes, and one of the three things that surgeons care about, weight, uncontrolled diabetes, and smoking, this now has created more opportunity for them to incorporate different tools and things into their practice. Pain management has become something that I've seen as a trend. They're hiring pain management physicians, or even GPs, general practitioners, there to handle some of the patient's other concerns. So it has definitely expanded.
Yeah, PM&R, right?
PM&R,
physical medicine, rehabilitation, chiropractic. Some groups are hiring chiropractors.
Yeah. Excellent. So each time we're going to just take a pit stop. So I'll be asking a question. It's a unique question that exercises opinion, but it's rooted in fact. So this is your chance for an opinion out there. So if you could instantly master one new health or fitness skill, what would it be? And this would be an interesting one for you, leading the gyms and the health spas that you're doing. So,
mastering a fitness skill?
A fitness or new health. It could be general health. What would it be?
Gosh, work, marriage, kids, scheduling. If you can get me 26 hours in a day so I can get a 90-minute, no, I'm kidding. 90-minute workout in. No.
More time.
I think, ultimately, you have the tree of Adam there as the kind of the orthopedic tree in the background, and it's on the Prescribe Fit website. I think for me personally, my goal is to move every day at a minimum 30 minutes in terms of exercise, whether that, if I'm sore from a workout, it could be a 30-minute walk, right? But I think a new skill would be multiplanar movement. And the things that we did as children, it was perfect squat pattern, and we kind of reach. And I think ultimately long-term, and this goes back to the managing the whole health of the patient, and where the chiropractic, physical therapy, it all comes into play for the episode of care and the surgical outcome, is that movement that naturally over time, from sitting at a desk, sitting in a car, things that tighten up our body, right? Ultimately contribute to perhaps a less than desirable outcome.
It sure does.
And that's way more science to it than that then surgeon partners and clients are much smarter than I to talk about. But yeah, I'd say move every day, but more specifically, multiplanar movement.
Mm-hmm. That's excellent. Excellent. So the one, I'll go to the fact side or to this is where it comes from. So meal planning is actually what they've set out there. The experts that grocery shopping for health, budgeting for nutritious food, cooking efficiently and enjoyably, portion control, intuitive eating, like those kind of things help to lead to nutrient balance, chronic disease prevention, mental clarity, time and stress reduction, all those things and all that. So
if you're talking about that, not to interrupt, but shop on the outside of the grocery store.
On the outside, yes.
Only go in the middle when you're absolutely necessary. When you got to get bread or whatever.
I love that you know that strategy. Yeah, that's definitely a good strategy.
And the colorful diet.
And the colorful diet and a smaller plate too. If you use a smaller plate, then you can still fill up the plate, but it's less portions.
Use the plates they use in Europe, not the U.S.
Right. Yeah. No supersize me kind of thing.
not trying to create another Netflix special here.
Right. This is the start of it. It's birth right here. Well, awesome. So turning to ancillary revenue and practice or growth strategies. So ancillary revenue streams becoming increasingly important for private practices. Reimbursement rates decline. You want to replace something or want to augment it. So what are some of the most profitable and sustainable ancillary services you've seen orthopedic groups implement?
I think there's three, and then, one is ambulatory surgery center. So depending on the certificate of need state, and can they do that, right? Having ownership in their own surgery center, obviously, that's call it table stakes, just from a pure negotiating perspective. If you have an ownership in a clinic as well as an ASC, right? So number one would be the ASC and kind of the operations of that. But from an ancillary new kind of driver perspective, I'd say one is DME, which I can tell you, Brock, that having been in enough cast rooms and clinics and such, that there's no tried and true there's best practices, but nobody's doing exactly the same. And I think there's companies out there that are trying to help in that, and OSER and et cetera, in terms of optimization. But one is DME, two is remote patient monitoring, and three, I'd say, would be this newer segment of nutrition, cash pay. Four, you could argue, is biologics and injections, but there's so much variance there on where's the science, is it cash pay, can we get something reimbursed, right? But I'd say probably those three, from a DME, RPM, and nutrition, and kind of that piece, which Absolutely. Cash pay is figured out, right? Like it's tough to value that like in a transaction per se, because it's cash and it's discretionary, and it's still being figured out how that's going to be bundled into the patient episode.
So they're just leading off to what you said there. So your cash pay versus reimbursement volume in terms of revenue. When you're valuing a practice, does that make a difference? How do you do that there? And as a physician is looking forward and thinking, okay, maybe 3-5 years from now, I want to take a look at what are my options at this point for M&A or some type of different structure. How would you guide them through that planning for the next 1, 3, 5 years for that point where they want to be acquired and getting the most value out of the practice?
Yeah, I think it's a two-part answer, and that one is any potential partner, private equity or otherwise, is going to value stickiness into what has worked, not what we think will work in the future. So that's number one, is what's in the startup world, it's what's the recurring revenue, right? And how much can we value that? What's the client acquisition? What's the retention? All those things. It's no different here. NPS scores, right? Patient satisfaction. So I'd say one is retroactive, and what's the quality metrics that are in place. Two, which frankly is our job and our kind of one of our, I guess you could say, differentiators, is helping the practice illustrate go forward vision, strategy, and ultimately economics, if and when we execute on 6, 12, 24 months of growth, building a new service line, opening a surgery center, hiring these 2 new physicians, these 2 new nurse practitioners, whatever that looks like, PAs, and kind of building that in. And that's some of that is done across investment banking, right? Like you paint a go forward picture, obviously, for potential parties. But from our perspective, we only work with physicians. It's all we do. So we have a niche, and we know each specialty, orthopedics, cardiology, dermatology, and kind of where things are headed, where the puck is headed, and how to paint that picture. But then more importantly, what can be achievable and what discount do we place on that so that it's realistic and not painting a rosy picture of, well, there's this new PA, and so it's going to bring us X, and let's hope it happens. It's no, well, here's why, and here are the controls, and here are the kind of the benchmarks.
Yeah, they want to see the actual, not the projected there. That's what they're basically. Yeah. So it's good to start early on those things. I mean, the earlier the better.
Absolutely. I think, frankly, on that note, real quick, I think one of the biggest challenges are 30-40% of the folks, prospective clients who come to us, is they're way too late.
Yeah.
They're way too late in the game. They're like, oh gosh, I'm challenged, I'm stressed, I need a vacation. Maybe I'll sell. Well, and so I think ultimately my goal and our firm's goal is to help folks earlier on in the process, be a sounding board, have these conversations of where are you, and help, like a doctor, right? Assess, diagnose, and treat. Well, in our case, assess the market, where are you, diagnose kind of your options, and then ultimately prescribe something that could make sense if and when we agree on that.
Absolutely. Yeah, that makes me think of estate planning. In my previous life, I ran a home care agency, and we worked with a lot of estate planning attorneys, and it was just amazing how long and how far into the future and towards the end people waited to start planning, and then you see a lot of dollars just go out the window because they didn't do it early enough. So absolutely. So when you're looking at that, I mean, maybe that's a common mistake that you see practices make when they're rolling out ancillary service lines or trying to prepare for this.
I think one is retention, naturally, because if and when you want to pursue a sale or call it transaction, the number one, since it's a provider-based business, right? It's not a widget company, or it's not a SaaS product that can just scale itself with users. It's doctors treating patients, and if you lose a doctor and or their staff, clinician, nurse, any of that, that can be a challenge if it's a smaller kind of group, because naturally that's a huge hit, right, to the P&L and ultimately to the go forward picture. So one is retention. Other challenges are just naturally not unlike any other industry or business where there's multiple shareholders and there's egos and there's things that no different than getting a capital product in the OR approved. You had to get 10 surgeons on board. That's going to take a little time and massaging.
Sure.
But yeah, I'd say those are two primary kind of challenges.
Excellent.
And the third would just be administrative. Like if your books aren't clean, your accountant's behind, things that we got to help them catch up on.
Yeah, absolutely. So what do you see in the future? Ancillary services in orthopedic and musculoskeletal care, what do you see as the future of them? And are there any emerging opportunities for practices that they should be paying attention to? We met at AAOS several weeks ago, and we're walking around, seeing all the vendors that are there and inside the beautiful San Diego Convention Center hall. It's quite large. Probably got a lot of steps in, so you definitely got your 30-minute walk-in that day. So as you're walking around, do you see anything that like sparks your eye, or like the trends more or less than the individual companies that are there?
Yeah, it's interesting because, and I'm pausing because I think AAOS as a whole, and this is a lot of society meetings, are shrinking. That's the negative or the downfall. But I think the positive is that it's becoming less about shiny objects and, hey, here's a new prosthetic, even though it's like, how much new it really is there?
Right.
Versus bringing science and data, et cetera. I'd say the second part, which is positive, I think it's across the board. There's still a growing number of smaller booths, which to me speaks to the startups and or the Prescribe Fits of the world who are entrepreneurs and innovators and bringing things to the market that are going to help in the future. So what I would say is the top three things for me from AOS and just more in orthopedics and where the puck is headed is, one is nutrition. I always mispronounce it. I think it's en route, but I want to say en route because it's how it looks, right? Yeah. They're in Toronto, so forgive me, Alex and guys. Nutrition. Two is remote patient monitoring, because there's reimbursement and there's codes. And I know Prescribe fits in that world, but I mean, there's ways to explore things that'll help the patient and provide reimbursement, which I think every independent orthopedic surgeon watching or listening to this should explore and understand. And then number three is AI. And I won't go into weeds on that, but AI, I mean, it's everywhere. Every booth had some component being marketed on a board or whatever.
Mm-hmm.
And then number 4 is, of course, Arnold Schwarzenegger being everywhere in the Zimmer booth, but the ZB big booth. But well done to ZB. I mean, that's obviously it's a huge marketing campaign, and
Yeah.
but the guy's a legend. And I think when we talk about movement and mobility and competitiveness and health and vitality, like that's, I don't need to over market it, obviously.
No, he'd be the epitome of that, right? I mean, that and strength right there. Absolutely. So when you're looking at a company, how for M&A, just to kind of look at the financial part of this, how are they valued? What's the value and the multiple on, or as you're looking at an acquisition there?
Yeah, great question. So like any other sale in M&A, there is, it's a 3-step process. First is, from a valuation perspective, is EBITDA, right? Earnings before interest, taxes, depreciation, amortization. So basically, if a practice is doing, and this is just, I'm just going to ballpark, practice is doing 20 million in revenue, and let's say they have 3-4 million in EBITDA, right? Mm-hmm. So that potential in trailing 12 months, right? So let's just say it's 4 million.
Yep.
So all the potential parties out there who would be interested in that may pay in 21 and 22, 10 to 15 times, right?
Wow.
In the heightened years of M&A, whereas today it's more normalized given the financing environment and interest rates and kind of the macro challenges that are out there, or outlook, anywhere from mid to high single digits on a multiple that the potential parties would value that. So for raw numbers, if you just said you can achieve 10x, the offer would be 40 million to acquire that $4 million EBITDA practice, which then can be split, right, where the shareholders have a payout and then they roll over equity. So there's shared alignment and shared economic interest moving forward in the business. But yeah, the first step for us and for any prospective client out there is it's complementary, and it's understanding what is the value of my practice today, potentially based on our earnings, and then helping them decide based on the potential parties. Dermatology, there's 100 possible. Orthopedics, there might be 15 to 20 current private equity backed platforms. And then there's other potential private equity firms who have yet to invest in an orthopedic group that would be interested. That was a long-winded answer, but the valuation is EBITDA, the multiple on that.
Yep.
And then the second part is helping them understand who the potential parties would be. And then the third ultimately they would decide, hey, PGP, we're going to hire you and let's explore this. Mm-hmm. With no obligation, right? There's just, if they decide it's not a good avenue, then they can opt out or decide not to do a deal.
Yeah, absolutely. So when you're looking at this and you'd advise a practice, how important is cost control in this? I mean, practices might be drowning in this cost side of things, purchasing capital investments, other services, putting in a new ancillary service revenue and identifying, man, I got to spend $100,000 on this up front. Or maybe there's just a program that's offered that has a net positive profit right off the start. How important does that become for a practice in looking at this?
Yeah, it is important. I think one example is like we're working with a few orthopedic groups now, and it's one's an MRI. Mm-hmm. Like they have an MRI, but they want a new one, and there's obviously a capital outlay for that. And so as part of the exploration of a private equity partner that could provide a vehicle to then fund the MRI instead of having to fund out of their own pockets and take out personal guarantees and all that. So circling back though, yes, cost control is important, because even if a group is producing 30 million in revenue, 50 million, but their costs continue to skyrocket and they're not managing that, they're just naturally less attractive, right, to the market.
Sure. Excellent. Yep. I can understand that. Just like in any situation, I think in that. So sometimes in software technology, SaaS companies, I mean, it's on revenue, right? Now you have to have good gross margins, and usually SaaS companies do, but they're valuing it on revenue, not EBITDA. So this definitely takes a different perspective on how you manage and prepare for an acquisition and think about that.
Which ultimately it dovetails into ancillary services, right? Because the two biggest costs on the P&L are labor and supplies, right? The cost of your talent and your team, and the cost of everything coming from all the different vendors, right? Shipping to the surgery center or clinic that are being used. So any which ways we can explore other avenues to drive value for the patient and for the practice, that should be explored.
Yeah, definitely. And then when you look at focus on value-based care, patient outcomes are improved. How do you think that plays a role in building a strong practice? I mean, is there any advantages to being in those contracts, negotiating them differently, and or we're taking a look at it through a different lens than fee for service?
Yeah, the short answer is TBD. There's a lot of groups trying to get it right and trying to, like, there's a MIPS, right? There's a MIPS program that's been sort of come and go. The data has been inconclusive on its success. There's been ACO models that have Medicare Shared Savings Program, MSSP. I think the long and short of it is, so I worked with Derek Haas and Avant-Garde Health, another startup, kind of Series A stage, doing a lot of good things on understanding data and their understanding specifically from the surgical perspective and trying to help cut costs and better cut costs and be more efficient. But ultimately, I think they're going to help come out with other things that are going to help surgeons, not just in the OR. But I bring that up because I think it's value-based care has been a buzzword. It came out and it's like, okay, it's still a buzzword.
It still is. Yeah, I agree.
And so I think, frankly, Brock, we could have a coffee and maybe 3 months from now, and maybe we put a goal for ourselves, but like further do our own research to collectively and say, what can this mean? But the short answer, TBD, but there are groups in HOPCO and other groups out there that are aspirationally doing some of that. I think the bundled payments, right, that has had some success, but in other markets, less success. So, yeah, I don't know. I quite honestly on that one. The short answer, and then the third short answer for us at PGP, because it is a question, like where does that sit from a value perspective, and does it help our practice sell or not? Or it's sort of neutral still, because it's still all about historical patient revenue, EBITDA, and where's the practice headed.
Sound traditional practices that been lines
and
there.
That's across the board: orthopedics, cardiology, dermatology.
Okay. So we talked a lot about ancillary service being a good driver for building up the business and the valuation of a practice for merger acquisition. So looking at one ancillary service revenue, you're advising a practice and you weigh in on the best return on investment for this ancillary service. How do you help that practice evaluate what's good, what works, what's neutral, and what detracts from that?
Good question. The short answer there is I think there's going to be more of this. Our firm is purely in the advisement on the transaction based on the current business.
Okay.
So we do have a bench, if you will, of consultants that we refer to. So if and when you need a revenue cycle consultant, if and when you're going to explore, Prescribe Fit, obviously I can send them your way. If and when you want to just explore recruiting challenges or issues, have some contacts in the spine and orthopedic worlds that can help make introductions there. But our role is purely the kind of financial advisor, if you will, to the shareholders in the sale. Okay. As far as like getting the practice sort of in shape, if you will, or if we want to get our house in order, that's where we would rely on our bench strength of advisors and consultants across the ecosystem. And so we do have access to that. It's just not PGP. Michael and Ezra, the co-founders, they wanted to be purely focused on that process because it's anywhere from a 4 to kind of 12-month process once they hire us. Average is 4 to 8, but I think but the process starts early on at, like, to your point earlier, 2 years, 3 years of where are we going to be, right?
Yeah, excellent. And then if you could, so we're going to stop right here for our optimized signature question for every guest. If you could give one piece of advice, a superpower, if you will, to people out there to optimize their health and transform their life, what would it be and why?
What a question. I should toss a ball up and here we go.
All right.
Knock it out. No, I think to your point earlier, exercise is great, but it really is the meal planning. It's nutrition. It's not counting calories, but it's having a plan and being accountable to that plan. And even when you go to the grocery stores, again, to the point of shopping around. And I think other than that is, like, for me, my two accountabilities as far as exercise. So nutrition is my answer, and being accountable to they say diet, but a nutrition enriched process that becomes fuel for you from a macro and micronutrient perspective. Outside of that, I think it's just, again, move every day. That's my thing. But for me, it's my Apple Watch, my 3 rings on there, and then my Lifetime app showing me monthly and quarterly how much I've checked in and what does that look like, right? So
Yeah.
some type of accountability measure would be the second part of the answer.
Hey, accountability is everything, I think, for anybody, no matter who you are. You could be the world's best professional athlete, and your fans hold you accountable there.
Yeah.
You know,
Oh, yeah. Yeah. In Chicago, we're struggling there. We got no good. Well, the Cubs, I'm a White Sox fan, so unfortunately,
yeah,
but ultimately, we haven't won anything in Chicago in a number of years. So,
sure. Yeah.
For Columbus, I don't know how the Blue Jackets doing. I'm not sure. I forget.
Yeah. Blue Jackets are okay, but our crew team, professional soccer team, they're great.
Nice.
Yeah.
Nice.
Yeah.
Yeah, we have the Chicago Fire and the Chicago Red Stars. So I think the Red Stars are pretty good. So there you go.
Yeah.
We got the Red Stars. Or now I think they're just the Stars. Could be wrong.
That's great.
Brock, we could go on orthopedics, hips and knees, fitness, wellness. We'll have to grab a coffee and talk value-based care in a few months here.
We should. Yeah, that's right. That's true. So just anything else that you'd like to discuss today? Anything else that you have that you feel like it's important or I didn't cover?
No, I think the only last comment, things are changing rapidly. And I think it's for anybody watching who's an independent physician, orthopedics, business owner, thinking through things, and maybe there's challenges and inflection points out there. Think about where the puck's headed right now, where it is. So, and we're at PGP, we're here to help you navigate that.
That's great. That's great. So then that leads into the thing. Where can listeners find you? Where's the best place?
Yeah, I'd say either LinkedIn or shoot me an email. Happy to be a sounding board. Email's tcunningham@physiciangrowthpartners.com.
Awesome. Well, thank you for joining us today very much, Tom. It's great to have you.
My pleasure, Brock.
Yep.
Appreciate you having me.
Awesome.
Have a great day.
That's a wrap for today's episode of Optimize, where we empower providers to enhance patient care. We appreciate you joining us as we explore the innovative ways to improve patient outcomes through lifestyle health.
Thank you for listening to this optimized podcast episode from Prescribe Fit. Make sure you never miss an episode by following the Optimized podcast in Apple Podcasts, Spotify, or wherever you listen. If there are any topics or guests you'd like to hear on our show, email your suggestions to optimized@prescribefit.com. And to learn more about Prescribe Fit's virtual lifestyle coaching and remote patient monitoring program, visit prescribefit.com.